International Long COVID Awareness Day, observed each year on March 15th, is a time for people around the world to come together in coordinated awareness and action. Patients, caregivers, families, friends, community allies, public health leaders, clinicians, researchers, and many others unite globally to raise awareness about the realities and impacts of long COVID. 6 years into the pandemic, we continue to advocate for stronger public awareness and education, robust clinician training, coordinated and accessible care, meaningful and inclusive research, effective treatments and cures, and comprehensive support services. Our efforts aim to advance public health, save lives, and drive change in areas that have been long neglected. We continue to fight for our lives. We advocate to educate, and we educate to drive solutions. What is long COVID? Long COVID is a serious, chronic, disabling, and potentially fatal condition that can follow mild and even asymptomatic COVID-19 infection. It is not rare, it is not resolved, it is not behind us. 6 years into the ongoing COVID-19 pandemic, incidence remains ongoing. Reinfections continue to increase cumulative risk. Long COVID is not resolving, it is sustained and growing. This represents one of the most significant public health and disability crises of our lifetime. Long COVID strains families and caregivers, disrupts education, pressures healthcare systems, challenges disability infrastructure, and threatens long-term economic stability. Yet we still lack approved treatments or cures. Hundreds of millions of people worldwide are impacted by long COVID. Global estimates suggest that approximately 36% of individuals infected with COVID-19 may develop long COVID. In the United States, CDC estimates from 2022 indicated that about 1 in 5 adults, 20%, who were infected with COVID-19 developed long COVID. Data from the NIH Recover Initiative suggests that 14 to 20% of children infected with COVID-19 also develop long COVID. By 2022, CDC serology data showed that more than 3/4 of the US population had already been infected with SARS-CoV-2, placing the estimated number of Americans living with long COVID at approximately 55 million at that time. Nearly 4 years later, with many more initial infections and reinfections, which increase the risk of developing long COVID, the number of people affected has likely grown substantially. While some studies suggest that only about 5% of people with long COVID recover, NIH Recover electronic health record data indicates that the overall incidence of long COVID continues to rise over time rather than decline or plateau. Using a 20% average prevalence estimate and the current US population of approximately 266 million adults and 74 million children, the estimated number of Americans who have experienced long COVID reaches roughly 68 million people. With only about 5% recovering, this suggests that more than 64 million Americans may still be living with some form of long COVID today. While not all people with long COVID experience limitations to their daily activities, a significant portion become disabled. Since 2020, the start of the pandemic, US disability rates have risen by more than 35%. Labor data shows similar trends, with more disabled individuals either leaving the workforce or struggling to remain employed. Estimates from 2022 suggest long COVID may account for up to 15% of unfilled jobs nationwide. COVID-19 infections and long COVID lead to immune dysregulation, autoimmune disease, cognitive decline, cardiovascular disease, organ damage, autonomic dysfunction, neurological impairment, cancer, and increased mortality. National Mortality Surveillance has identified thousands of US deaths with long COVID noted on death certificates, a figure experts acknowledge is a substantial undercount. Long COVID likely involves overlapping biological mechanisms with current research pointing to viral persistence, immune dysregulation, autoimmunity, latent virus reactivation, endothelial and microvascular injury, autonomic dysfunction, neuroinflammation, microclots, impaired perfusion, microbiome disruption. Identifying mechanisms and biomarkers are essential for the development of target therapeutics and preventatives for long COVID. Patients with long COVID continue to be failed by recognition, care systems, and public health infrastructure. Major barriers include a failure by government to respond to this public health crisis at the scale required, despite the growing number of people affected and the long-term societal impacts. Absent, credible, and consistent public health messaging that reaches diverse audiences and clearly communicates the risks and realities of long COVID. Lack of education and clinical care guidelines for healthcare providers, leading to delayed recognition, dismissal, and inconsistent care. Insufficient engagement and education of policymakers, limiting effective policy development and resource allocation. Limited resources to support research, care coordination, clinician and student training, and patient support services. Poor clinical recognition, resulting in inadequate documentation and coding, which undermines surveillance, public health response, and funding decisions. No FDA-approved treatments or standardized clinical care pathways, contributing to untreated illness, insurance and disability denials, financial hardship, fragmented specialist-based care, clinicians declining complex patients, and progressive disease, including death. Failure to maintain basic prevention measures, including access to high-quality masks and respirators, particularly in healthcare settings. Limited access to accurate and timely testing, affordable diagnostics, and early treatment options such as antivirals and monoclonal antibodies. Without recognition, there is no documentation. Without documentation, there is no data. Without data, there is no response. The response must match the scale of the crisis. We need prevention of infection and reinfection, clear, credible public education, clinician education and training, accurate diagnosis, documentation, and surveillance, school and workplace accommodations, funding proportionate to the scale of the crisis, national and global recognition of long COVID as a major public health threat, destigmatization of patients and disease, biomarker and treatment development, large-scale longitudinal and mechanistic research, strong, coordinated care infrastructure, prevention, recognition, research, funding, and care must move. Why patient advocacy is essential. Patient advocacy has been fundamental to the recognition and progress of long COVID. Patients and caregivers were often the first to identify symptom patterns, document the condition, and push for scientific and clinical recognition when systems were slow to respond. Their lived experience reveals care gaps, research priorities, and systemic barriers that traditional medical frameworks often overlook. Lawmakers must hear directly from their constituents to understand the scale and urgency of the crisis and to take meaningful action. Without direct engagement from affected communities, policy responses risk being delayed, misdirected, or insufficient. Clinicians and researchers also miss critical indicators, symptom patterns, and care gaps when patients are not meaningfully included in research, study design, and clinical discussions. When governments respond without patient partnership, resources are often wasted on poorly targeted programs and duplicated efforts. This delays progress, prolongs suffering, and contributes to worsening health outcomes, including progressive disease and death, while also deepening systemic impacts across the economy, workforce, schools, and families. Patient partnership accelerates progress. Without it, systems move slower, waste resources, and fail the people they are meant to serve. How the COVID-19 Long Hauler Advocacy Project serves the long COVID community. The COVID-19 Long Hauler Advocacy Project is a patient-led long COVID 501c3 nonprofit organization grounded in the belief that education is the foundation for every effective response to long COVID. Education drives recognition, improves documentation and care, strengthens research, informs policy, and ultimately improves patient outcomes. Our mission focuses on advancing education and building sustainable infrastructure capable of responding to long COVID at the scale this crisis demands. We pursue this through advocacy, resource development, cross-sector collaboration, peer support, and by centering the lived experience of people with long COVID in research, policy, and care. C19LAP has played an active role in advancing long COVID recognition, policy, and research. Our leadership contributed to the National Academies of Sciences, Engineering, and Medicine report and U.S. consensus definition of long COVID. We co-drafted the Treat Long COVID Act and provided language for multiple federal and state legislative efforts. We also partnered with Senator Bernie Sanders to introduce the Long COVID Awareness Day resolution. C19LAP has served as advisors to the Center for Medical Specialty Societies and the AHRQ Long COVID Care Network, and we participate in the NIH Recover Ancillary Studies Committee. Through the CDC Foundation's IQ program, we serve as both a grantee and chair. We have also developed key educational resources, including the Comprehensive Guide to Long COVID, our Public Health Response Guide, and our Public Health Resources page. Our early community reporting on long COVID trends helped inform the White House memorandum on long COVID and the federal actions that followed, including reports, offices, committees, and broader cross-government initiatives addressing long COVID. For Long COVID Awareness Month this year, C19LAP has sent nearly 1,000 outreach letters to federal health agencies, every U.S. governor and member of Congress, all state departments of health, national public health agencies and associations, medical societies, and media outlets, urging recognition of Long COVID Awareness Month and calling for meaningful action. As a result of this outreach, several major health authorities, including HHS, CDC, WHO, and the Minnesota Department of Health, issued statements, posts, and communications recognizing #LongCOVID Awareness Month. Engaged directly with congressional offices, including multiple discussions with Senator Bernie Sanders' office, a recent meeting with Senator Todd Young's office, and an upcoming meeting with Senator Tim Kaine's office. Volunteer-led outreach and meeting scheduling continue beyond Long COVID Awareness Month, with several states already responding. How you can help raise awareness and drive action for Long COVID. Contact your elected officials, send letters to your members of Congress, governors, and state departments of health urging action on Long COVID. Engage your professional networks, share information with colleagues in your institutes, societies, associations, and healthcare systems. Volunteer with C19LAP during Long COVID Awareness Month and throughout the year. Participate in the Social Media Week of Action during Long COVID Awareness Week, March 15 to 21. Light it up teal to show support and bring visibility to Long COVID. Share the fact of the day and other educational resources across your social media platforms. Use Long COVID awareness graphics, change your profile picture, and wear Long COVID awareness gear. Include children with Long COVID in the conversation and advocate for their recognition and support. Donate to support C19LAP's work or start your own fundraiser. Share your outreach efforts. Post about the actions you took, share photos, connect with others, and join your C19LAP state group to stay engaged. Together, awareness leads to recognition, and recognition leads to action. The COVID-19 Long Hauler Advocacy Project is a patient-led 501c3 nonprofit organization advancing solutions for long COVID through education, research, advocacy, cross-sector collaboration, resource development, and peer support, centered in lived experience. Much of this work has been carried out by disabled volunteers fighting for their lives and the lives of millions of others. But the demand for our work has grown far beyond what volunteer capacity alone can sustain, and this crisis requires the funding and infrastructure needed to meet the scale of the need. Your support helps C19LAP develop, deliver, and sustain public, clinician, and academic education to improve prevention, early recognition, accurate documentation, clinical decision-making, access to support services, and patient outcomes, while advancing care coordination and practice change to reduce diagnostic delays, medical gaslighting, and prevent avoidable patient harm, alongside the development of patient-created, multidisciplinary resources that integrate clinical, scientific, policy, and lived experience knowledge. Federal, state, and local coordination across agencies and sectors to align public health, healthcare, research, and policy efforts. National coordination of Long COVID Awareness Day and Month actions to amplify consistent messaging and engagement. And community mobilization through 60+ state and community-based chapters, including peer support infrastructure, volunteer training, local leadership development, and national reach. Patient-centered research agenda setting and translation, with patients identifying priority areas of investigation in Long COVID and serving as partners in brainstorming, study design, recruitment, facilitation, analysis, and dissemination, ensuring science is informed by lived experience and implemented in real-world care, alongside relationship building and action facilitation among patients, caregivers, clinicians, researchers, public health leaders, and lawmakers. Prevention and risk reduction initiatives, including mask distribution and education, to reduce infection, reinfection, and downstream long COVID burden, alongside public trust building and stigma reduction through consistent, evidence-based messaging. Rapid response to emerging research, policy changes, public health announcements, and crises affecting the long COVID community, combined with broad, comprehensive advocacy representing priorities from communities across the U.S., informed by years of long COVID work and established cross-sector relationships, as well as real-time problem-solving for patients and caregivers and routing individuals to trusted resources and information. Sustained presence at public health conferences to reach thousands of stakeholders, including clinicians, researchers, medical schools, legislators, departments of health, community organizations, religious institutions, and others, to educate them about long COVID and COVID safety, strengthen media and advocacy capacity, and speak directly about the education, research, and community needs required to drive and deliver meaningful change. How you can help. This campaign invites you to support patient-led solutions for long COVID. You can help by starting your own fundraising campaign through our Zephy page with a goal of $1,500. Share it with your friends, family, and networks, and invite them to support you or a loved one living with long COVID during #LongCOVID Awareness Month. Making a one-time donation of $15. Giving any amount that feels meaningful to you. Donating $15 on the 15th of each month, or $15 every 15 days, the 15th and 30th. Sharing this campaign widely and encouraging others to support our work. Every contribution helps sustain the education, advocacy, and collaboration needed to improve patient outcomes, accelerate solutions, and ensure people living with long COVID are included in decisions that affect their lives. Long COVID is a long-term public health crisis, and it requires long-term, patient-led solutions. You can donate through our Zephy campaign, PayPal, or check. To schedule a meeting with us to discuss potential major gifts, please email contact@longhauler-advocacy.org. Learn more about long COVID, COVID-19, and the COVID-19 Long Hauler Advocacy Project today. Check out our Long COVID Awareness Month in the Resources tab. Head to longhauler-advocacy.org.